Pregnancy interruption indications and techniques. Deliberate termination of pregnancy either by medical or by surgical method before the viability of the fetus is called induction of abortion. It can be legal or illegal. Coming to the indications. To save the life of the mother in the following cases: cardiac diseases, grade 3 or grade 4, with a history of decompensation in the previous pregnancy or in between the pregnancy, chronic glomerulonephritis, malignant hypertension, intractable hyperemesis gravidarum, cervical or breast malignancy, diabetes mellitus with retinopathy, epilepsy, or psychiatric illness with the advice of a psychiatrist. Social indications. This is almost the sole indication. Pregnancy caused by rape or unwanted pregnancy caused due to failure of any contraceptive devices also fall in this category. Eugenic. This is done under the provision of substantial risk of the child being born with serious physical and mental abnormalities so as to be handicapped in life. The indication is rare. Structural anencephaly, chromosomal Down syndrome, or genetic hemophilia, which are the abnormalities of the fetus. When the fetus is likely to be deformed due to the action of teratogenic drugs like warfarin or radiation exposure which is greater than 10 rad. In early pregnancy, rubella, a viral infection affecting in the first trimester, is an indication for termination. Methods of termination of pregnancy. First trimester up to 12 weeks, we can use medical methods like mifepristone and misoprostol, which is prostaglandin E1, methotrexate and misoprostol, tamoxifen and misoprostol. Surgical methods include menstrual regulation, vacuum aspiration, suction evacuation and or curettage, dilation and evacuation, which can be rapid method or slow method. From the second trimester, 13 to 20 weeks, we can use prostaglandins, prostaglandin E1, 15 methyl, prostaglandin F2 alpha, which is carboprost, and their analogues. Dilation and evacuation, intrauterine instillation of hyperosmotic solutions, and they have given 3 examples: extra amniotic ethacridine lactate or prostaglandins, which can be prostaglandin E2 or prostaglandin F2 alpha. Extra amniotic saline infusion, which is isotonic, with a transcervical catheter balloon. Intra-amniotic hypertonic urea, 30% or saline, 20%. Oxytocin infusion. High dose is used along with either of the above 2 methods. Hysterectomy, which is less commonly done. Complications. There are 3 categories of complications. First one is immediate complications. There can be injury to cervix, which can be called lacerations, uterine perforation, hemorrhage and shock due to trauma, incomplete abortion, thrombosis and embolism. Post-abortal pain, bleeding and low-grade fever due to retained clots or products. Now, gynecological complications. It includes menstrual disturbances, chronic pelvic inflammation, infertility due to cornual block, scar endometriosis, uterine synechiae leading to secondary amenorrhea. Obstetric complications. This includes recurrent mid-trimester abortion due to cervical incompetence, ectopic pregnancy, preterm labor, dysmaturity, increased perinatal loss, ruptured uterus, rhesus isoimmunization in rhesus negative women if not prophylactically protected with immunoglobulin, and failed abortion. This is a short overview on topic pregnancy interruption or induction of abortion. Thank you for listening.